A 5-year-old woman enters your clinic looking exhausted. She describes widespread aching and extreme difficulty getting out of bed. As a doctor, your clinical instinct is vital here. Misdiagnosing these conditions can lead to either unnecessary treatment or severe complications. Miss Polymyalgia Rheumatica, or PMR, and you leave an inflammatory fire burning. This could potentially lead to permanent vision loss. Conversely, miss a fibromyalgia diagnosis, and you may subject a patient to years of high-dose steroids they simply do not need. To distinguish these effectively, think of it as a hardware versus software problem. PMR is a hardware issue involving systemic inflammation. PMR physically inflames the tissues surrounding the shoulder and hip girdles. This creates objective markers, like a raised ESR and CRP. Fibromyalgia is a software problem. The peripheral tissues are structurally healthy, but the brain's pain processing system is malfunctioning. This central sensitization causes the brain to amplify normal signals into severe pain, yet there is zero actual tissue inflammation. Because there is no inflammation, blood tests like the ESR and CRP will be completely normal in a fibromyalgia patient. Let us look at the 4-step algorithm. Step 1 is checking the age. Fibromyalgia typically affects women aged 30 to 50. PMR is a disease of aging. It is rarely seen in patients under 50 and is classically diagnosed in those over 60. Step 2 is mapping the pain. PMR presents with shoulder and hip girdle stiffness, which is significantly worse in the morning. Fibromyalgia presents with pain in all 4 quadrants of the body, often accompanied by tender points, poor sleep, and IBS symptoms. Step 3 is checking the bloods. Normal inflammatory markers point towards fibromyalgia, while an ESR above 40 suggests PMR. Remember that muscle enzymes like CK and EMG results are normal in both conditions. Neither is a primary muscle disease. Step 4 is the therapeutic trial. If you suspect PMR, prescribe prednisolone 15 mg per day for a short period. The response to steroids in PMR should be dramatic, with near-complete relief of symptoms occurring within just a few days. If the patient shows no improvement after a trial of steroids, you must reconsider your diagnosis, as it is likely not PMR. Consider a 6-8-year-old woman with neck and hip stiffness. It takes her 2 hours to loosen up, and her ESR is 65. This is a classic case of PMR. Before you treat, you must ask about new headaches, jaw claudication, or visual disturbances. PMR overlaps with giant cell arteritis in 30% of cases. This is a sight-threatening emergency that requires immediate attention. Once GCA is ruled out, start the patient on 15 mg of prednisolone daily and expect a rapid improvement in mobility. Now consider a 3-5-year-old woman with 6 months of widespread pain, chronic fatigue, and IBS. Her blood markers are normal. This is fibromyalgia. Note the younger age, the distribution of pain across all 4 quadrants, and the lack of inflammation. Management for fibromyalgia focuses on patient education and aerobic exercise, which currently holds the strongest evidence base. You may consider neuromodulators like amitriptyline, duloxetine, or pregabalin to help manage symptoms, but never prescribe steroids. For PMR management, taper the prednisolone slowly based on clinical response, which may take several months or even years. Always co-prescribe bone protection for PMR patients on long-term steroids, including a bisphosphonate, plus calcium, and vitamin D. 3 common mistakes to avoid. First, never treat fibromyalgia with steroids, as they provide no benefit and cause harm. Always check the ESR first. A normal result confirms there is no inflammatory process to treat with steroids. Second, never forget the GCA screening questions for PMR patients. Any sign of visual change is a medical emergency. Third, do not underestimate the severity of morning stiffness. PMR patients often struggle with basic tasks like brushing hair. Remember the core takeaway. PMR is the 5-0 plus girdle fire, while fibromyalgia is the 3-0 plus total body alarm system. If the ESR is 5, it is fibromyalgia. If the ESR is high and the patient is over 60, it is likely PMR. The best diagnostic test for PMR is a dramatic response to steroids, while the best treatment for fibro is aerobic exercise. Check the age, the location, and the ESR. Use these 3 pillars to guide your diagnosis and keep your patients safe.